Professional organizations have declared mass shootings in the U.S. to be a public health crisis, including the National Association of Social Workers, the American Medical Association, the American College of Emergency Physicians, and the American Public Health Association. There are several definitions of mass shootings, and little is known about their causes. One definition is an event in which 4 or more persons were killed, possibly including the shooter. This graph from Washington Post or WP data shows the yearly numbers of mass shootings, 1966 through 2019, based on this definition. By this definition, there were 174 mass shootings this 54-year period. The Gun Violence Association, or GVA, gives a broader definition, which is 4 or more persons wounded and or killed in the same incident. This graph shows the monthly numbers of mass shootings from 2014 through 2019. By this definition, 2,697 mass shootings occurred this 72-month period. As this graph shows, the rate of mass shootings depends on the definition of mass shootings. The rate in 2014 by the GVA definition, shown in red, was 90 times greater than the rate by the WP definition, shown in black. And the rate in 2020 by the GVA definition was 300 times greater than that by the WP definition. Research has identified numerous factors associated with violence and mass shootings, including income inequality, gun ownership, unemployment, and gross domestic product. It has been hypothesized that violent political rhetoric, or VPR, may be associated with mass shootings. No studies have yet investigated this possible link. In a first-of-its-kind study, Zaitsev in 2019 measured VPR in the U.S. using New York Times news articles. This graph shows the rates of VPR he found per year from 1966 through 2019. The sharp increase in this graph started in 2015 and was associated with the 2016 presidential campaign. To confirm the increase in VPR starting in 2015, Zaitsev measured VPR as reported in news articles in 8 national newspapers other than the New York Times. This graph shows the rates of monthly VPR from 2014 through 2019 found by Zaitsev. These results confirm the increase starting in 2015. In Study 1, we investigated the relationship between VPR and mass shootings between 1966 and 2019 using the WP definition of and data on mass shootings. In Study 2, we investigated this relationship between the years 2014 and 2019 using the GVA definition of and data on mass shootings. In Study 1, independent variables included income inequality, gun ownership, and changes in GDP. The hypothesis-independent variable is the rates of VPR from Zaitsev's New York Times measures. In Study 2, the hypothesis-independent variable was Zaitsev's measures of VPR based on news articles from the 8 national newspapers. We conducted multiple analyses, including autoregressive distributed lag, or ARDL, analyses. We also conducted finite distributed lag, or FDL, Poisson time series analyses. In all analyses, VPR was significantly and positively associated with mass shootings, controlling for other independent variables. The solid curve in this graph shows the yearly rates of mass shootings from 1966 through 2019, and the dash curve shows the ARDL model predicted rates of mass shootings. The ARDL model explained 80%, and VPR uniquely explained 41% of the total variation in mass shootings. The solid curve in this graph shows the actual and the dashed curve the Poisson model predicted numbers of mass shootings from 1966 through 2019. Results showed a 3-fold increase in risk of mass shootings associated with an average increase of 4 VPR-related articles per 2,000 New York Times weekly articles. Our second study used GVA monthly numbers of mass shootings, and the hypothesis-independent variable was monthly rates of VPR from the 8 national newspapers. This graph shows the monthly numbers of mass shootings from 2014 through 2019. As can be seen in the graph, there appeared to be periodicity in the mass shootings. Spectral analysis results suggested a 12-month periodicity in mass shootings, and results of a harmonic regression analysis found VPR significantly and positively associated with mass shootings. The periodicity accounted for 51%, and VPR uniquely accounted for 10% of the total variation in mass shootings. The solid curve in this figure shows the monthly numbers of, the dashed curve shows the 12-month periodicity in, and the dotted line shows the hypothesis-predicted relationship between VPR and monthly numbers of mass shootings. The dotted line shows the positive relationship between VPR and numbers of mass shootings controlling for the periodicity. The most significant limitation in these studies was the single source of rates of VPR, newspaper reports, which could contain various biases. Future research on the relationship between VPR and mass shootings needs to use broader and more inclusive measures of VPR, including measures of the severity of violent political rhetoric. As far as we know, these are the first studies to investigate the relationship between VPR and mass shootings. A strength is the convergence of results based on both narrow and broad definitions of mass shootings. The results were consistent with research showing VPR associated with willingness to engage in political violence and to act on existing prejudices. These results converged to suggest a positive relationship between VPR and mass shootings. Results also suggested a positive relationship between mass shootings and income inequality, and a negative relationship between increases in GDP and mass shootings. There also appears to be a 12-month periodicity in mass shootings. No relationship was found between gun ownership and mass shootings. Results support further research on the relationship between VPR and mass shootings. Results also imply professional disciplines such as social work, psychology, public health, and allied professions develop programs and methods to reduce the use of violent political rhetoric. On a final note, this graph shows monthly numbers of mass shootings by the GVA definition through 2020. Note the 76% increase in mass shootings in 2020 relative to numbers between 2014 and 2019. The results of our two studies suggest this spike may have been, at least in part, associated with the contentious 2020 election season.